I've been practicing for over a decade now, and one of the biggest questions that we get from a lot of our patients when we go over their findings is, Doc, what did I do to get so bad? Or how did I end up getting to the state of health that I'm currently in now? Now, the honest answer to that is, honestly, I just don't know. For me to actually know and find out, I would have to follow you throughout your entire life to figure out what led you up to this point today. Now, what I can tell you though is most likely an accumulation of the three stresses that we call the 3 T's. That is going to be your thoughts, your toxins, and your traumas. Now I want to go through this and explain a little bit more about this information so you have a better understanding about what maybe have led you to this point in your health journey now. If you don't know him, I'm Dr. Robert Rosas with Ahava Chiropractic, and I make these videos because a lot of our patients have this question about these types of topics. So I hope someone out there in the internet world would benefit from this information as well. So let's jump right into it. Now, the first thing that I want to talk about is your thoughts. Now, one of the best ways that I have understood to help to explain this is that some of you out there who are bold and courageous enough to watch scary movies, I don't know why you do it. I don't do it because I'm a chicken, I guess. But really the reality is that when people like to watch scary movies, what happens in a scary movie? You're watching from the comfort of your home on your couch in the safety of your house. And as you're watching this on TV, you see this person getting into a situation where like, no, don't go in, don't go in, don't do it. And all of a sudden the music starts to increase, and all of a sudden, boom, something jumps at you, something shouts, and then you get scared, right? And what is your response? Oftentimes we scream, we shout, our heart rate goes up, we're feeling chills, we feel agitated, we gotta do something. But what happens? You go into a sympathetic state, which is your fight or flight response. But the reality is nothing is happening. You're just perceiving that something is actually happening in front of you when you're just in the comfort of your home, in the safety of your home. But what happens is you go into this sympathetic state or your fight or flight response. I call this the gas pedal in your body. You also have a brake pedal, which is called your parasympathetic state. And that's also the rest and digest, or some people call it the feed and breathe state. Now, when you're in this sympathetic state, that is what we would consider your stress response. Now, just so you understand, stress can be a good thing. We want to be stressed. We want to be able to become stressed. So if you have a deadline, you're trying to get something done for work or at school, you want to be able to get stressed because it's going to help you to become more focused, hyper aware. You're going to have your heart rate increasing because you want more blood flow going on in your body. But what happens is when that happens, you're actually not worried about digesting your food. So the blood flow goes away from your digestive system and into the muscles. You're not worried about reproducing. So there's so many different things that happen. But what happens is this: too many times people don't ever allow themselves, when they become stressed, to exit out of that state and go into more of your parasympathetic state or your rest and digest. And so this is why we want to try to teach people how to go from your stressful state and into your restful state. Now, on the other note too is this, is that people oftentimes not just have stress, but they also go through some moments of depression. Now, depression is actually a normal thing as well. You can consider it sadness or depressed. People go through some serious things in life, whether it be a loss in their family. Some people lose their job or go through a divorce or break up with their boyfriend or girlfriend, or so many different things in life that really warrant some sad feelings. And that's okay. I want you to understand that is a normal feeling. However, if we stay in that state, that's where we're going to find ourselves in trouble. Because if we stay in a state of either depression or stress, we get chronic health conditions, whether it be heart disease, whether it be digestive issues. Because again, if we're in a sympathetic state, our blood flow is not going to our digestive system, and so we're going to get constipation or lack of bowel movements. So many things happen with your digestion. Sometimes we'll have reproductive issues. We'll see erectile dysfunction or different things like that, lack of arousal. So there's so many different things that we can see if we don't allow ourselves to go from a sympathetic state into your parasympathetic state. So let's talk about how we can manage our thoughts. Now, the first thing I want to say is that you want to direct your focus. Now, what do I mean by that? Now, there's a guy that I listen to. His name is Tony Robbins. He's a motivational speaker. Some people like him, some people don't. It's all good. There's some things I don't agree with him as well. But there is one thing that I really like that he says. He says, in a room full of people, he tells the room, I want you to find something red. So people are looking around the room, red, red. Okay, they see red, they see red, and they close their eyes. And then he's like, I wanted to see what is blue. And people are like, I wasn't looking for blue, I was looking for red. So they didn't find that out. They can tell you what's red, but they can't tell you what's blue. So he has them open their eyes and he's like, all right, find blue. So blue, blue, find blue. Okay, now we find blue, right? The same is true when you are looking for things in the world that will either match your state. So if you're in a negative state, oftentimes people look for things to confirm that state. So they're looking around in the news, they see all the crime, the violence, all the, the stock market crashing or all this other stuff, or they look at global warming, oh, the world's going to an end. There's so many different things that people focus on that is negative. However, you can switch that and turn your attention to things that are positive. And if you can do that, you're going to start to notice around you there's a lot of good that's actually happening as well. Maybe you got an air conditioning room in the summer heat, like right now it's like 100 degrees and I'm in air conditioning. Maybe it's that you have food on your plate. Maybe it's that, you woke up. I have so many patients that are saying, I ask them, how you doing? They're like, Doc, I woke up today, it's a good day. They focus on the good around them. Now, I'm not saying ignore the negative, ignore the bad things, ignore the stuff that's going on, but just where do you spend your time thinking? Where is your attention? That is one of the best things that you can do to improve your thoughts. The next thing that you can do is take a deep breath. When you're in a sympathetic state, you're in a fight or flight mode, you want to try to get your body into a restful state. But when you're in that gas pedal mode, your breathing is more shallow. You're trying to huff and puff because you're trying to survive, you're trying to flight, you're trying to run away. Taking a couple of deep breaths in through the nose, out through the mouth, what that's going to do is it's going to tell your body and your brain, hey, I'm okay. Things are okay. And you're going to go from that sympathetic state into more of a restful state in your mind. The next thing that you can do is exercise. Exercise has so many benefits, but one of the benefits that it will do is give you what's called an endorphin release. That's your happy drug in your brain. It's going to help you to feel good after you exercise. I know during the time that you're exercising, sometimes you're like, oh, I don't want to exercise, it's hurting, it's painful. But after, you're like, wow, I felt accomplished, I did something good. You have these uplifting positive feelings because you exercise. The second thing from the exercise is that you actually allow yourself to be distracted. When you're going for a hike and you're walking or you're exercising, you're going for a run, you're not thinking about all the negative stuff that's been going on in your life, but you're focusing on getting the movement in your body. That is a benefit because if you keep focusing, again, on the negative stuff, then you're going to keep staying down. But if you can change your focus, change your activities, change your state, that's going to really help with your thoughts. The next thing is finding a community. You're not meant to be a lone wolf in this life. We're not designed to be that way. We're meant to be tribal, community-based. And if you have people around you supporting you, encouraging you, that's going to really help to improve that the thought as well. The other thing is prayer. Again, some people go through some crazy stuff. I have so many people that come into our office and they tell me some crazy stories of some people that have experienced loss, gone through some hardships and gone through some things. And one of the things I always say is, I'm a Christian, so I recommend prayer. I want to give as much of the stuff that I worry about as much as I can to God, because it does me no good to control and focus on things I can't control. So if I can give it away, give it to God and let go, that's going to improve my mental state as well. And if you're not a Christian, if you're not a believer in a faith, then give it to the universe. I don't know, whatever you feel like you need to do, but give it away, because if you can't control it, why worry about it? The last thing I want to recommend for this in terms of your thoughts is seek help. Ask for help. It's no shame going to a therapist, a counselor, your pastor, your community. Ask people for help. Ask people to help you to process some of the stresses that you have throughout your life. That's going to be super helpful in regards to managing your thoughts. Now, the second T is going to be your toxins. Now, your toxins is really what we're going to be consuming into our body. Think of the air. There's pollution in the air. There's toxins in the air. If I'm walking down the street, there's so many cars that pass me, so I'm breathing in some of the smog. Some of the food that we're ingesting, so whether it be your food, the beverages, your energy drinks, sometimes it's drugs and medication. So there's so many different things that are toxins that are consuming, that we consume on a regular basis, that we don't know exactly what it's doing to our body. Now, I will say many times we can get so stressed out about our toxins that it creates negative thoughts. So we can think about all the stuff that we can't control, the pollution in the air, global warming, we can't fix this stuff. And you can, maybe sometimes we can move from where we're at into a better place that has less pollution. However, I'm in California, there's a lot of pollution here, and I love being in California, so I won't move. So I can't control the pollution here. So what can I do instead? What I can control is what I eat and what I consume, which is basically your diet. Now, diet can be so complicated. There's so many different things that you can do, and some of it actually works great, and sometimes people get really great benefits from it, but I always try to keep it as simple as possible for my patients. And I always tell people, just eat whole foods. and nutrient-dense foods that are actually going to be rich in resources that you can pull from the food and extract so your body can actually use those resources. So things like the dark green leafy vegetables. Now, I'm not talking about the iceberg lettuce, which is just basically water dense. It makes for a great burger, nice crisp and nice crunch if you eat into it, but you want more nutrient dense leafy vegetables. So things like spinach, things like kale, broccoli, Brussels sprouts. There's so many different nutrients that come from these vegetables that your body's going to be able to use them to whether be healed, to allow your body to function properly, and then also actually helps to manage your stress as well. A lot of times if we're eating a bunch of junk food, processed food, it's going to put a lot of stress internally, physically, and it's going to create more stress on our mind mentally as well. The other thing is drinking plenty of water. We want to make sure we're drinking plenty of water instead of all the sugary drinks that we consume, the rock stars, the energy drinks. We want to drink things that are actually going to be more useful for us. And so whether it be water, there's smoothies that you can drink that are more nutrient dense with like all the vegetables and stuff. If you don't want to eat your fruits and veggies, drink them in a smoothie. So many different things that we can do to allow our body to have the resources that it needs to heal and function. Now, the third T is going to be traumas. Now, in our office, we focus on two major traumas. It's going to be your micro traumas and it's going to be your macro traumas. Now, your macro traumas are going to be things like your car accidents, the trips, the falls, the sports injuries, so many different things that we acquire throughout our life because, we live life. We can't do anything about it, right? We're just going to go through it, and sometimes we're going to get some injuries along the way. That can also shift some things in your body and your spine specifically, and when that shifts, you're going to lead to damage to the joint, which is going to lead to pain, irritation, inflammation, and damage to the nerve, and that can lead to a lot of aches and pains and dysfunctions within the body as well. The second trauma is going to be the micro traumas, and that's going to be more of the repetitive stresses. So think of someone who is on your cell phone. Maybe you're watching this video on your cell phone or maybe on a laptop. What does our posture look like if we're doing that? Our head's going to be down in our hands. It's going to put more stress onto your neck, stress on your mid-back, going to put a lot of strain onto your spine. If you're sitting on a wallet, if you sit on a wallet that's like an inch thick, some patients I have patients who sit on these 2-inch wallets and it's propping their pelvis up. Why it's 2 inches, I have no idea. They got to be wealthy, I assume. But the reality is if you're sitting on that thing, it's going to push your pelvis up. It's going to start shifting and moving some things within your body. Now, if you sit 5 hours a day, 8 hours a day, 10 hours a day, and you're sitting on that wallet, it's going to cause some stress onto your spine. So there's so many different habits and things that we do on a regular basis that we would consider micro traumas that's going to put strain onto your body. Now, what can we do when we suffer traumas or injuries? Now, the first thing is get some movement in the body. Now, it used to believe that rest is the best thing, but unfortunately that is proven to not be beneficial. Now, when I say that you want to get movement in the body, it's not just continue your regular activity in your daily life. You actually want to take a step back and ease some of the stress that you're putting on your body by going lighter on your exercises, lighter on your work, and you want to try to get movement in the body, because what it's going to do is your body needs movement to bring in blood flow to the areas to get some healing elements, but also needs movement to push out some of the inflammation and the toxins that build up as well. So movement is found to be very, very helpful in the healing process. Now, like we talked about with your toxins, eating better. Now, you don't want to eat a bunch of junk food, processed foods that has no nutrients. It just has a bunch of calories, making people overweight or obese. You want to actually eat more nutrient-dense foods, because that's going to give your body the resources and the tools for the healing process. That's going to really be helpful to get your body in the recovery state. The other thing is sleep. We think sleep is overrated. I know for me, I like to work and I like to be productive, and I had to learn that sleep is one of the most productive things that we can do for your entire well-being, but especially when it comes to the healing process. It's going to allow your body to recover in terms of the muscles. When you're injury and straining your joints and your muscles, it allows for the healing process to take place. It allows for your body to stay in that sympathetic state, your parasympathetic state, which is going to be more of that rest and digest, but that allows for the healing element. Now, the other thing is I want to mention is you want to seek for some help. Now, if there's some stuff that you've gotten some injuries, you want to make sure that you're getting some help to get those to get into your recovery state. Now, when I say help, there's some things that you need to figure out in terms of a health team, because I'm a chiropractor and we get great, amazing results for a lot of our patients, but we are only one piece of the puzzle. I tell people all the time, if you broke your bone, you broke an arm, don't come to me. I'm not going to help you. Go to your medical doctor, go to the emergency room, right? You need to find the appropriate resource to help you with some of the traumas that we inquire. And so what I always tell people, build a health team around you. I would love to be part of your health team, or as chiropractors, you want to find a great chiropractor that can help with some of the shifting and movements in your spine. You want to have a great medical doctor. My wife's a pharmacist. I believe entirely that there's a time and a place for medication. If there's something that you got blood pressure, we got to control that thing, get some blood pressure medication, do whatever you need to do, seek your medical advice to make sure you're getting the proper help and treatment that you need. But you might want a physical therapist. They have great things that they have to offer, an acupuncturist, a personal trainer. You want to build a health team around you to really help you to achieve the results that you're looking for. And so I really encourage you, if you are suffering from some aches and pains and some disease and sickness, look at your life. What are the areas that are maybe not doing so well, whether it be your thoughts, whether it be the toxins, maybe some traumas, or maybe it's all three. But I can guarantee it's an accumulation of some of the stuff that's leading to the state of health that you're in today. And so, like I said, I recommend working on these things, seeking some help, learning in some of the videos like we're doing today, get educated to help improve your health today. Thank you so much for watching. That's it. If you enjoyed this video, please click that like button. Subscribe to our channel to watch more videos just like this. And if you have any feedback, any comments, anything that was helpful, anything that was not helpful, please leave the feedback in the comments below. We'd love to hear your feedback. Thank you so much for watching again. Have a great day. God bless. Peace.